What really happens when you stop taking your diabetes medication? This is one of the most important conversations we need to have in diabetes care, especially in the low and medium income countries where access to medicines, finances, stigma, side effects, burnout, and misinformation affects the treatment adherence with diabetes. Some people stop because they feel, oh, I feel so much better. And some stop because they're just tired, they're exhausted. And some just stop because they can't afford the medication. And others stop because someone told them, oh, you don't need those drugs anymore, just use herbs. But diabetes doesn't disappear simply because your symptoms just became quieter. Sadly, many people only realize the danger when the complications begin. So today I'm going to break down what happens inside the body when diabetes medication is stopped, why blood sugars can silently start rising and creeping up, and the warning signs people ignore most times, the short-term and long-term complications, and how to safely manage medication concerns without causing harm to yourself as an individual. This video could actually save someone's life. Now let's head straight to the business of the day. To ease understanding and followership, I'm going to break down the information into sections. So now we're going to start with section 1, why diabetes medication matters. Diabetes medication is not just medicine, it is a support for a body that is struggling to regulate glucose properly. In persons with type 1 diabetes, insulin is life support because the body no longer produces any form of insulin. On the other hand, persons with type 2 diabetes, medication actually helps improve insulin sensitivity, reduces glucose production, or increase insulin release depending on the treatments that you're on. Without proper glucose control, excess sugar tends to remain in the bloodstream. And when the glucose stays high for too long, it now begins to damage your blood vessels, your nerves, your kidneys, your eyes, your heart, and even your brain. Many people expect immediate symptoms after stopping medication, but in all honesty, diabetes can damage the body very silently for months, even years, before obvious signs appear. That is why diabetes is sometimes called a silent condition. So now, section 2, let's look at what happens when you actually stop taking your medications. So number 1, your blood sugar starts to rise. And this can lead to excessive thirst, frequent urination, blurry vision, fatigue, very dry mouth, headaches. So this is your body literally like struggling to remove any excess glucose through urine. Then the second thing that happens now is the body starts to break down fat and muscle. So this happens when the body cannot use glucose properly. This now results in rapid weight loss, which is seen in people with chronic high blood sugars. And then you're so weak. And then there's a lot of muscle wasting and extreme tiredness. In type 1 diabetes, especially, this can actually become very dangerous quickly. So now, number 3, the risk of diabetic ketoacidosis. So this is the danger zone for persons living with type 1 diabetes. So if you miss your insulin, DKA will happen. And what causes this to happen is your body starts to produce excess ketones because it cannot access glucose for energy. Because what insulin does is that it unlocks your cells to be able to take up that excess glucose in your bloodstream. So when this doesn't happen because of no insulin or not enough insulin, then ketosis happens and ketones become very toxic to the blood, and that's what makes you ill. So the symptoms to look out for include vomiting, abdominal pain, rapid breathing, you have that fruity, smelly breath, and you have very severe dehydration, and confusion ensues as well. So an important note here is that DKA is a very, very serious medical emergency and can become very fatal if it's not treated. So this is why insulin should never, and I repeat, never be intentionally stopped without any medical advice or supervision. Number 4, increased risk of hyperosmolar hyperglycemic state. So this is called HHS. In persons living with type 2 diabetes, extremely high glucose can lead to very, very severe dehydration and a dangerous condition that I have just mentioned, known as hyperosmolar hyperglycemic state, HHS. This may cause very, very severe weakness. You have loss of consciousness, you get confused, and in some cases, seizures can happen. So you need to note here that this is also a very serious medical emergency and should be treated in the hospital setting. Now, section 3. I'm going to talk about the long-term damage from not taking your medication. So even if you feel okay, uncontrolled diabetes can slowly damage the body. Over time, poorly damaged diabetes can just increase the risk of so many secondary complications. So you must always take your medication. So I'm going to start listing the complications that can result from long-term high blood sugar levels. Number 1, eye damage. So high glucose damages those tiny blood vessels in your eyes. This can lead to blurry vision, retinopathy, and vision loss. Now let's look at the second organ that could be damaged from prolonged uncontrolled blood sugars. Kidney disease. We all know that the kidney is the big filter of the human body. So the kidney actually filters the blood continuously. And when your sugars are very high, they overload the filtering system of the kidney, and this could eventually lead to kidney failure. Now, we're going to look at nerve damage. This may cause your feet to lose sensation. You will have tingling, numbness, and you can feel some burning heat sensation under your feet. A point to note here is that many people in the low and medium income setting present late with severe foot complications because early symptoms were just ignored. And number 4, we're going to talk about the heartbeat of the human body, and stroke. So when you don't manage your blood sugars well, you're prone and is predisposed to developing heart disease and stroke. So we can say that uncontrolled diabetes significantly increases your cardiovascular risk, and uncontrolled blood sugar levels can damage your arteries and increase high blood pressure, heart attacks, stroke risk. So now we're going to move to section 4. Let's look at the reason why people actually stop taking their medication. In this conversation, we need a lot of compassion and empathy. Many people stop medication because they could be going through some financial struggles, could be as a result of cultural beliefs, it could be as a result of stigma, diabetes, burnout, fear of using insulin, religious misconceptions, side effects, lack of proper education, and sometimes or most times online misinformation. In many African and low and medium income settings, Some people are told, oh, you are healed, throw away your medication, herbs alone can cure diabetes. This misinformation can be very, very deadly. And to be honest, there is nothing weak about you needing medication. Using diabetes medication properly is self-care and not in any way failure. So section 5, what should you do if you are actually struggling with your medication? If you're struggling with your medication, the first thing to do is you need to speak to your healthcare team, discuss any side effects. Honestly, don't beat about the bush, or you feel that you can't express yourself. Please express yourself, speak about it, discuss it with your healthcare team. Ask about cheaper alternative if cost is a problem for your medication purchase. And you also need to learn how your medication works, build sustainable routines, seek diabetes education, and never stop medication suddenly without proper guidance. And I need you all to remember that feeling normal, in quotation marks, doesn't always equate to your blood sugars are under control. You need to monitor. So monitoring matters a lot, and education matters a lot. Consistency matters. My call to action today is you need to remember that diabetes is not all about perfection. No, no, no. It's not all about perfection. It's about risk reduction, protecting your long-term health, and giving yourself the best quality of life. Your medication is not, it's not in any way your enemy. It is one of the tools helping you stay alive, stay functional, and stay well. If this video has helped you understand diabetes better, please, by all means, like, share, subscribe, and send this to someone who needs this information today, because one conversation can actually prevent one complication, and one piece of education can save one life. This is me blowing your way reality-based diabetes education from my own lived experience. I'll see you all in my next video. Bye.